Okay, thank you, Betsy. Thank you, Amy, for inviting me to chair or to co-speak with you today. With the title, Why is my teen so tired? We are faced with a prospect first, and again, I come from the perspective of a sleep psychologist. The first thing is we've got to figure out what do we mean by tired. And when you use the word tired, it really drums up a whole host of possibilities. In the field of sleep medicine, professionals are taught to define the difference between tired or fatigued and sleepy. Okay, so looks like we may have a couple of teens, or at least some parents of some teens in the audience, so maybe you'll recognize these common scenarios. Mom, I'm too tired to take out the trash. I'm too tired to rake the leaves. I'm too tired to finish my homework, and I am certainly too tired to clean my room. However, tired being more in the lines of fatigue and feeling lethargic is not the same as being sleepy and having a tendency or propensity to actually fall asleep when you're supposed to remain alert. We know that daytime sleepiness has an impact during the day. We know that it impacts behavior problems. Teens are more likely to become more active, have poor impulse control, get involved in risk-taking behaviors. We know there are neurobehavioral, neurocognitive deficits in terms of attention, concentration, memory, and especially with executive functioning, and especially with long-term, more boring, monotonous tasks. We also know that daytime sleepiness, as many of us parents of teenagers, impacts teenagers' mood. They're more irritable, angry, and can become sad and depressed at times. We also know that if you look at the bottom performers in a classroom setting, a very, very high percentage of those children are going to have an underlying undiscovered sleep disorder. Finally, I think we often forget about the family impact, and I just actually came from the Sleep Disorder Center, and each and every day I go into that clinic, I'm just amazed at the impact on the entire family, on parent-child interactions, on sibling interactions, on marital relationships. When everybody's tired, or when the child is not sleeping, or the adolescent is not sleeping, oftentimes the parents aren't sleeping or the siblings aren't sleeping. So it definitely has an impact on the entire family, oftentimes not just the teen. Recent data linking obesity with sleep, both sleep deprivation and obstructive sleep apnea. And the mediator appears to be a hormone called leptin, another one called ghrelin. And then I think I read somewhere that sleepiness actually promotes premature aging, but I'm not actually sure about that. Okay, I'm going to help you, and again, I'm sure that you're all here for different reasons, but I'm going to help you try to think and analyze like a sleep doc, okay, to try to figure out and isolate exactly what may be going on with a teen who is sleepy during the day, not tired, okay, not fatigued, but is actually sleepy, having trouble falling asleep in class, having trouble with waking up to attend school, actually struggling to remain awake when they're supposed to remain awake. The first one is actually, I'm going to start down here when we talk about fragmented sleep. Basically, if you look at excessive daytime sleepiness, the two on top here that I'm showing are related to insufficient sleep. And it's no secret that if you don't get enough sleep, you're going to be sleepy the next day. The bottom two more often are related to medical problems, more rare, but oftentimes more serious problems. So I'm going to start with a teenager who's getting enough sleep. And I'll talk about what enough sleep is a little bit later, but yet their sleep is poor quality, it's fragmented. And obviously the first one that comes to mind is obstructive sleep apnea. This actually peaks at 2 to 6 years of age when toddlers end up having tonsils and adenoids that are a little bit too large for their faces. But we also certainly are seeing more and more obstructive sleep apnea and resistant or sleep-related breathing disorders in the entire population due to the growing obesity epidemic. We also see occasionally children and adolescents present with periodic limb movements. These are involuntary limb movements, usually of the legs and feet, that occur during sleep. Okay, this is not restless leg syndrome that we see on TV oftentimes, where we've got this inability to move, or I'm sorry, this unrelenting desire to move our limbs prior to sleep. But periodic limb movements come along with restless leg syndrome. These are actually involuntary, cyclical, oftentimes flexions of the legs and ankles. You'll see them occur every so often in a periodic manner. And oftentimes they're more disturbing to the bed partner than they are to the person themselves. But if a child or adolescent is getting plenty of sleep, and yet they're sleepy during the day, we need to look at the quality of their sleep and see what may be fragmenting things during the night. Okay, so now I'm going to move over here to what I would call primary disorders of excessive daytime sleepiness. I'm certainly not going to cover them all. The most classic one I think we've all heard of is, and that's narcolepsy. Very rare, I mean, undoubtedly very rare, especially in children. We'll see it start to appear oftentimes in adolescence. But this is actually a sleep disorder that fragments sleep at night, okay? But the sleepiness occurs multiple times during the day. And the sleepiness is unrelenting, and you'll see some rather interesting, strange phenomena occur along with this unrelenting desire to sleep. Okay, the first one is cataplexy. And basically you can think of this as REM sleep, or rapid eye movement sleep, intruding into our wakefulness. So what happens when we have rapid eye movement sleep? Well, we dream, our muscles shut down, so we don't act out our dreams. Cataplexy, you'll hear teenagers talk about rubbery legs or knees, you'll see drop attacks occasionally where people just absolutely faint. You'll see them fall asleep in the middle of conversation, etc. But oftentimes cataplexy is triggered by strong emotions such as surprise, shock, or fear. Hypnagogic hallucinations basically is dream mentation that starts to bleed into your waking life. So these occur right as you're falling asleep, and you actually may have a very realistic hallucination. And again, REM sleep, we dream. You'll actually see things, hear things, smell things that aren't there. And again, rather than in a psychotic manner, these occur only during the transition from sleep, or from wakefulness to sleep. Sleep paralysis is just the inability to move upon falling asleep, or usually upon waking up. So people who are just chronically and severely sleep deprived may actually experience sleep paralysis. It doesn't necessarily mean you have narcolepsy, but most people discuss the fear that they have when they wake up, and they can look around the room and it feels like somebody's almost sitting on their chest, but they can't move because, again, the brain has shut down muscle control, so you don't act out your dreams. Again, very rare. Likely not the cause. It's usually the last thing we look at, but it needs to be on the board when you're looking at why your teen is so sleepy. So if you've got any concerns that this teenager is snoring, has sleep apnea, may have symptoms, some funky things going on during that transition from sleep to wakefulness, is having drop attacks or falling asleep multiple times during the day despite getting what should be enough sleep at night, you really need to run, not walk, to your local sleep disorder center and get a professional evaluation. Okay, now we're going to get to the more common scenarios, and that would be this is what I would call in my teenager's language the no duh answer to why is my teen so sleepy during the day, and that is they're not getting enough sleep. Okay, so we're going to talk about this one over here being insufficient sleep or sleep deprivation. So I'll just ask some folks out here, anybody have any idea how much sleep a teenager is supposed to get? And it varies a little bit, but not actually. 8 to 10 hours, it's a big range, but you've got it bracketed pretty well. Anybody want to pinpoint that even more?
I would have guessed 9.
That's pretty darn close. That's pretty darn close. I've looked at total sleep time studies from the 1980s till here recently across a variety of methodologies, but basically the best studies have been done by Mary Carskaden out of Rhode Island, and what she has found is that there really is not a lot of individual difference. Okay, she has teenagers attend her summer sleep camp, And it's funny because the young teenagers go, why would I want to do that? And the old teenagers, they all, the juniors and seniors in high school, they're like, where do I sign up? Can I get paid for sleeping? Because they're often by that time still sleep deprived. But it's 9.2, 9.25 hours, okay? And the way she does that, she puts kids in bed for 10 hours, the same 10 hours over a number of consecutive nights. And they almost all fill up the entire 10-hour slot with sleep until they work off their chronic sleep debt. And they finally start to wake up on their own, alert, not to an alarm clock, not to a parent nagging them. They wake up on their own, and you can identify your own individual sleep requirement. You can do that during the summer, okay, to identify your own sleep requirement. But we're usually looking at 9 hours. How many are most of our high school kids getting during the school week? 7 to 7.25. It's worse in Japan, a lot worse. Okay, I've read some articles. I mean, a lot of the students in Japan are going to school after school. They're studying all the time, and I think the average was closer to 5 hours a night. Okay, they're literally burning a candle at both ends. So, but here in the United States, it's about 7.25 hours of night. So basically, most of our teens are attending school with a 2-hour sleep debt each day, and by the time you hit Friday, they're missing almost an entire night's sleep. And if you test them, if you do the objective daytime nap test that we use to assess for narcolepsy, many of our teenagers today are functioning in the narcoleptic range. It's dangerous. It's just flat out dangerous. Okay, the last one, looks like my words just kind of leaked out of my box here. Circadian rhythm disorders. This has more to do not with the quality and not the quantity of sleep, rather the timing of sleep. And anytime I have a teenager walking into my sleep clinic, I can pretty much bet the mortgage, that it's going to be an issue of timing, okay? And that is, if you look just at the typical teenager today, bedtimes are becoming later. There are a variety of reasons for that. Rise times become earlier on school days. Why? Because in elementary school, they go to school at about 9:30, then they move to middle school, they go to school about 8:30, 8:40, and then by the time they're in senior high, they're going to school at closer to 8 a.m. So they're getting less and less sleep. So with later bedtimes, earlier school times, they're ending up with chronic sleep deprivation. So total sleep time, TST is total sleep time, by the way, decreases on school days, and then what they do is they make up for that mounting sleep debt on weekends by sleeping until noon, 1, 2, 3 o'clock, okay? And the more they sleep till 1, 2, 3 o'clock, then they start to influence their physiology, making it even more delayed, okay? And then they have trouble, of course, going to bed on Sunday night at a reasonable time. So if it gets to be too bad, many of these children, or I'm sorry, these adolescents end up with delayed sleep phase syndrome. And the classic scenario here is they have trouble falling asleep at a reasonable time. Okay, they sleep fine if they just delay their bedtime until the time that their body is prepared to fall asleep. They have a heck of a time waking up in the morning. They are groggy, they're moody, they have a tough time even staying awake in their first class or two in the morning. And then if you look at vacations during the summer, their sleep is fine because they match their time in bed with their natural circadian biologic rhythm. So they naturally go to bed later and wake up later, and they get enough sleep. And again, the peak onset occurs in adolescence because, okay, puberty triggers it. So this is very much induced by puberty. It's a biological phenomenon. It's very well known. This is a confusing slide. It's a little bit blurry. I apologize. But basically what I've done is taken core body temperature here. Our core body temperature and how alert we feel naturally ebbs and flows during the day. And basically, we feel most alert as our body temperature is rising, okay? And we get sleepy, drowsy, groggy as our body temperature is declining, okay? So here, let's say this is you're going throughout your day. You have lunch, and here's kind of that 1 o'clock dip, okay? For me, that's 2:30 every afternoon. I know not to schedule anything important. About 2:30 because I'm a little bit out of it, a little bit just naturally sleepy. See if I can find my pointer here. Okay, we get that natural rise, we get that second wind, we're productive in the late afternoon, okay? We get in the evening time, and depending on what time your bedtime is, what time you feel like you're drowsy, our core body temperature decreases. So what happens with a teenager is, if this line, okay, whoops, I didn't mean to do that. If this line is what most people are on, okay, everything for the teenager, and again, triggered by puberty, ends up being delayed. Okay, so again, it's not the amount of sleep, it's just that the core body temperature, the natural peaks and dips in alertness and drowsiness becomes delayed. Meal times often become delayed. Activity patterns when they do their homework, delayed. Okay, and what you'll see is with late sleep phase, you either have bedtime struggles in little kids or this burst of activity late at night. Okay, and even if they went to bed earlier, they're not going to fall asleep. And then, of course, because everything's delayed, they have a heck of a time waking in the morning and actually making it to school on time. This is, well, this changed a little bit. I don't know if you can see that very well with the way it is, but basically this is actually a 15-year-old that I just saw last week. Okay, and I know this is tough to see from here. It was bigger, but, and I don't have my glasses on. This child was actually falling asleep around 4:30, 5:30 in the morning. So this is pretty delayed. And then if he didn't have to attend anything, you know, he would sleep easily until 3, 4 o'clock in the afternoon. And what's involved here is, believe it or not, salivary dim light melatonin. If we look at melatonin onset, it's not that, because a lot of people have questions about the use of melatonin in teenagers. And it's not that they don't have melatonin. It's not that they don't have their own and sufficient melatonin. It's the timing, okay, of when their melatonin is actually secreted. The timing is delayed. Okay, so there are a number of not only biological factors, obviously with puberty, you know, hormones, the triggering towards a delayed sleep phase preference. But we also have psychosocial factors, especially in today's society, that also impact adolescents who are not getting enough sleep. Okay, number one, as teenagers become more independent, they become more involved, they have more homework load, they're attending athletic events, they become more social, they get a new cell phone that now offers them text messaging, as my 13-year-old just did. There's just so many factors in today's society that compete with sleep. Okay, and oftentimes, because again that delayed preference, they may be going to bed later than their parents, and it's tough to monitor them. Okay, and it's tough to really. They want to do their own thing. They think they knows what what's best, but it really takes some time to be able to regulate and monitor your sleep-wake schedule. Okay, for resources, if you guys are interested in either finding handouts, listings of professionals in the local area, the American Academy of Sleep Medicine actually has a very comprehensive website, and I would encourage you to tap into that. If you're interested in coming to Children's Hospital, we actually have a pediatric sleep disorder center that is in combination or cooperation with the University of Nebraska Medical Center where I work. The number to get an intake appointment there is 955-REST. I think that is it, and I'm going to let Amy talk about the other differential diagnoses. Thank you.
All right. I'm fighting off a little croup, so I'm hoping my voice is going to hold out for this presentation today. If you see me pause to drink my tea once in a while, I apologize, but I'm going to go ahead and talk a little bit more about teenagers and being tired all the time. And when as parents, we should start worrying about how tired our teenagers are. So teenagers complain a lot that they're tired. I'm too tired, like Dr. Kuhn said, I'm too tired to mow the lawn, I'm too tired to do my homework, don't talk to me now, I'm too tired, we can't do this now. So when should you worry? When are they too tired, and when should you worry that maybe their fatigue is outside of normal limits? Anytime a teenager's fatigue or degree of tiredness, and by fatigue what I mean is they are too tired to do their normal daily activities. When you're talking about fatigue, it's not sleepiness or not that I'm falling asleep every 5 minutes. It's my body just feels tired all the time, and I'm not interested in doing those normal things that I should be doing. When fatigue is interfering with what their job is, as I often say to my teenagers and my patients, your job is to go to school, just like my job is to go to work every day. Your job is to go to school, is to get your homework done, and then to do any other things that you're really interested in doing. Those are your jobs. And if teenagers are too tired to do their jobs, there's a problem going on. If they're falling asleep in class or they're falling asleep on the job, if their grades have fallen in school and they say, I just can't concentrate, I'm too tired, I can't do it. If they've had serious problems with work, a lot of teenagers are going out into the workforce, even part-time. They haven't been showing up to work on time because they're falling asleep after school. That's a big deal. If they can't make it to school and they're getting called into the office because they've had 12 truancies so far, or 12 late appearances at school, there's a problem there. And especially with teenagers, if their fatigue or their being tired is interfering with their relationships. Family relationships, of course, but also peer relationships, because that's really an important part of developing teenagers' lives and their autonomy, is their relationship with their peers. And if suddenly they're dropping off relationships and they're dropping off friendships and they're not going out with their friends, and they say the reason is, I'm just too tired, I'm going to bed, that's something that should be concerning to parents, because that's a really important part of a teenager's life. A lot of teenagers who have fatigue have a lot of physical complaints that go along with their fatigue. Some of them are very worrisome, some of them not so much. And these are really common physical complaints that teenagers have often when they are tired or they have fatigue. And those include things like headaches, back pain, abdominal pain, cramps, abdominal cramps and crampiness, and dizziness. And those are very nonspecific symptoms that, in other words, they don't particularly point to anything necessarily. They're relatively common. They don't, unless they are something that's completely debilitating. Now, if your teenager has excruciating headaches every day that wake them up, that's different. But complaining of headaches once or twice a week, taking some Tylenol, that's not uncommon. Complaining of feeling dizzy, especially right when you get up in the morning, that's relatively common as well, and happens just from shifts in your body fluids, especially if you don't drink enough fluids, like a lot of teenagers have this problem. But these are common complaints, not necessarily alarming, but you see them a lot in kids who are chronically sleep deprived or chronically tired and overworked. Concerning things. So what kind of symptoms or what kind of physical things should make parents worried about their teens, that there's something else going on? And these are things that I think it's important to talk about, because there are some things that are really important and should be red flags to parents and say, whoa, you need to take your teenager in to see the doctor. If a teenager is losing weight without trying, that's important, and that means that there's something else going on probably. Likewise, if a teenager is gaining weight rapidly and they haven't changed a whole lot about what they're doing, they haven't changed their exercise patterns, they haven't changed their food intake really, but their weight seems to be going up. Those are signs that there may be something going on that you need to visit with a physician about. Significant constipation, having difficulty having bowel movements on an everyday basis, to the point that you need to take medication every day. That can be a problem, and constipation combined with hair loss, both of those things can sometimes mean that there's a thyroid problem, especially those things in the light of any kind of family history of people with thyroid problems are important to think about. If your teen complains that they have heartburn or reflux, and sometimes they'll say, I get acid in the back of my mouth, or my chest is burning, or I'm really uncomfortable right after I go to bed at night, I burp up stuff all the time, that can be a sign that they have a problem, and that may interfere with their sleep and contribute to their fatigue, because often in teenagers who have reflux, they have worse symptoms at nighttime, and that can certainly interfere with sleep. Any teenager whose parents hear them grinding their teeth during the night, that's an issue that really needs to be addressed too, and that's something that you may need to call in other healthcare providers to address, the dentist obviously. But someone who grinds their teeth at night, you expend a lot of energy doing that, and it really interferes with normal sleep. So that's an important thing as well. Someone who's going to the bathroom a lot, peeing all the time, they run to the bathroom every 5 minutes, every 10 minutes. The most adults think of that as being associated with a urinary tract infection, but it can also be associated with diabetes, any kind of diabetes. And that's something that's important and can also contribute to fatigue. And in families with a strong history of those things, they're important to evaluate. Other symptoms that might make you concerned about your teenager. In females, once they start having periods, changes in their periods or irregularities in their periods can be very important, and no teenage girl wants to talk about their periods with their parents, so you have to really ask and talk to them about that, and those are really important things. Someone who has really prolonged periods that last for 2 weeks, or very heavy periods where they're changing pads or tampons every couple of hours for more than a day, that's a lot of bleeding, and that can lead to anemia, which can also make you feel really tired beyond just regular sleep tired. Those problems can also indicate that you might have a thyroid problem also. Any changes in periods are affected by your thyroid gland. And there's something called polycystic ovary syndrome, which also can cause you to have really heavy or irregular periods, or sometimes actually even absent periods. Having absent periods is another problem for teenage girls, and obviously the first thing anybody should think of if their teenager isn't having periods is, could they be pregnant? And that's a really important question to ask. Also, thyroid disorders, eating disorders. If someone is not having periods, eating disorders like anorexia can interfere with that normal cycle and can also create a lot of fatigue and a lot of exhaustion. And excuse me, I gotta get a drink. And aside from eating disorders, adolescents who exercise a significant amount, so these are your teenagers who are involved in very competitive sports. They may go to school in the morning, and before school, they'll swim for 2 hours. Then when school's done, they'll swim for another 2 hours. Adolescents who exercise a large amount of hours a day competitively often have such little body fat that they stop having periods, and that affects their energy as well. If your energy is so low that you can't have periods, there's a problem, and you need to address that with that adolescent and their family. Again, polycystic ovary syndrome can also cause absent periods as well. Substance use, I think you have to talk about when you're worried about an adolescent with fatigue. Anytime I see a teen in my clinic whose parents are concerned that they're tired all the time, I ask the teen and I ask their parents separately and in private, are you using anything, or do you think your teen is using anything that is interfering with their wakefulness during the day? Any medications, any street drugs, any over-the-counter things that they have access to that might be making them sleepier than they should be. I think that's really important to address, and it's very common. And it's very common for teenagers not only to use street drugs, but it's also common for them to use things around the house. A lot of parents have sleep aids around the house, whether it's Tylenol PM or medications that they've been prescribed by their physicians at different points in their life. And adolescents know about these things. They hear about them. They find them. So it's important to ask, what do you have in the house that they might be getting into? Because maybe they're having trouble sleeping at night and they're taking a medication, and then they're rebounding in the morning and they just can't get up because that medicine is still in their system. Depression and anxiety are separate things that are really important because they are so common. Depression, we talked about some of those sleep disorders earlier. Dr. Kuhn talked about things like narcolepsy and restless legs probably have a prevalence of about 1 to 2% in the general population. Depression and anxiety have a prevalence of somewhere between 10 and 20%. So they're really common things. And it would be wrong to not ask about those things or not be concerned about those things as a parent of a teenager who says they're tired all the time, because one of the main symptoms of depression and anxiety is fatigue, trouble sleeping. Both of those things are really key to those diagnoses. So it's important that those things get addressed really thoroughly to make sure that they're not the instigating problem. Sometimes with teenagers, we have this sort of chicken and egg thing with sleep and depression, or sleep and anxiety, which is what came first. Did the trouble sleeping start the depression, or did the depression start the trouble sleeping? And sometimes it's really difficult to sort that out, but those are really important things to try and tease out of a patient's or a teenager's history when you're trying to figure out why they're so tired all the time and why they're having trouble sleeping. Recurrent fainting. It's really common for teenagers to faint. My daughter fainted this summer. It was just, I'm a physician, and it still shocked the heck out of me. And teenagers do that sometimes. If someone had repeated episodes of fainting, I would be concerned about that. You could be concerned about things like cataplexy, which is more rare, but more importantly, concerned about things like anemia, or are they not getting enough fluids, and because of that, are they having recurrent episodes of fainting, or do they have something more serious? Fluids we can fix, anemia we can fix. Is there something going on with their heart, which is really important to not overlook? And talking about heart problems then makes me go on to think about other symptoms that are concerning with regards to, do they have a problem with their heart or with their cardiovascular system? Teenagers who are sleeping upright, teenagers who are short of breath with usual activities. So not the teenager who says, oh my gosh, we ran the mile today and I was huffing and puffing and I just couldn't do it. That is usually an out-of-shape teenager, all right? But the teenager who says, I went up who goes up a flight of stairs, and at the end of the flight of stairs has to stop and catch their breath. There may be other issues. They may be heart issues. They may be lung issues like asthma or exercise-induced asthma, but those are important things to not overlook. So being short of breath with usual activities or complaining of chest pain are unusual symptoms, chest pain that's unrelated to reflux. I think that it would be wrong to not talk a little bit about overweight and obesity. I know Dr. Kuhn already talked about it a little bit, but because common things occur commonly. And in patients who are overweight and have problems with fatigue and sleep, I think that it's important to say, all right, we're going to look and make sure nothing else is going on, but we have to understand that sleep issues are really prominent in everyone who is overweight, including teenagers and including children as well. So overweight, what's the prevalence in almost any community in the United States? The prevalence of overweight and obesity is 20 to 30%. It's really common. And we define overweight loosely, or as best as we can, by something called body mass index. And your body mass index is your height, or your weight in kilos, divided by your height in meters squared. That's how you figure it out. And normal age range for adult, or normal body mass index, or BMI range for adults is 20 to 25 or thereabouts. Now, there are some great big football players who probably have a normal body weight with a BMI of between 25 and 30. But for most individuals, somewhere between 20 and 25 is normal. Over 30 is overweight in adults, and any teenager whose BMI is over 30 is overweight. And that's how you figure it out. And it's really easy. You can go to I'm trying to think of the government website where you can look at the pyramid and figure out your weight and height. But anybody can go online and figure out what their BMI is and where they're at and look at where they should be. And it's important to know that if you are overweight in the over 30 category, you may have symptoms associated with that. And if you are overweight with a BMI that's 40 or more, it's very likely that you have problems significant problems related to that. And that can be fatigue, it can be back pain, it can be sleep apnea, gastroesophageal reflux, which also can affect sleep significantly, and constipation. So you can see there's overlap in a lot of different symptoms that adolescents can have. I could also explain a lot of those symptoms by depression. I could also explain a lot of those symptoms by thyroid disorder. So those are things that you really need to go to your healthcare provider to help figure out. So what part of this fatigue that I'm feeling is overweight related? Is some of it related to sleep apnea? What can I do about that? Because there are things that you can do to help. Obviously, the best thing you can do to help if you're overweight is to try and get involved in a program that will help you increase your physical activity and improve your eating habits and sustain a little bit of weight loss. And even as big of a difference as as little of a difference as 5 to 10 pounds of weight can make a huge difference in how people feel. I see a fair amount of adolescents and their parents who come in who have concerns that they might have chronic fatigue syndrome. And this is a term that came around, I think, and became very popular in the 1980s. Before then, we really didn't hear a whole lot about it. It is more uncommon in adolescents than it is in adults, but you do start to see it in adolescents. But chronic fatigue syndrome is a little bit different than I feel tired all the time. Usually when we see an adolescent who has chronic fatigue syndrome or chronic fatigue, and I try to stay away from the term syndrome because I think it can be related to many different things, that's defined as someone who's had symptoms of fatigue that have been going on for at least 6 months, which is a long time, and fatigue that interferes with their everyday activity, not just I feel tired and I complain to everybody about it all the time, but I haven't been going to school for 6 months. So this is serious fatigue that affects their everyday life. The definition of chronic fatigue is usually that it was precipitated also by some sort of acute event. That may be a trauma like a car accident, or it may be an acute viral illness like mono or influenza or strep, one of those things. But when we talk about chronic fatigue, usually the teenager can say, I had this horrible car accident and ever since then, it's just never been the same. So that's the kind of story you get. And to diagnose someone with chronic fatigue, you really have to prove that they don't have anything else causing their fatigue. So there's a few other, you have to make sure that, as I have to make sure as a physician, that they don't have a problem with their thyroid, that they don't have an issue with chronic depression, that they don't have obstructive sleep apnea or other things that are causing them to be so fatigued. And again, we have that whole chicken and egg thing. Chronic fatigue shares many symptoms with depression. And sometimes when you're fatigued for a very long time, you get very depressed. So we then have the problem of weeding out what came first, the depression or the fatigue. What's more, it's really difficult to break this cycle because you have fatigue that makes you depressed. And the depression makes you fatigued, and it goes round and round, and it just builds on itself, so that it can be very difficult to get these kids back to having a functional life all over again. There are other diagnoses that can be applied to adolescents. However, they're more common in adults, and I think that they're worth talking about. I'm not going to talk anymore about restless leg syndrome or periodic leg movement disorder, because I think Dr. Kuhn did a good job of describing those, except to say that sometimes they're associated with iron deficiency. And so as part of the workup for those things, it's important that we make sure that kids are getting enough iron in their diet and they're not low on iron. And this is a really common problem for adolescent females, especially because they have a period every month and they lose blood, and they need iron to replace that blood. And many teenagers don't get enough iron in their diet in the form of red meat. They eat a lot of carbohydrates, French fries. French fries are big. A lot of chicken nuggets. Chicken doesn't have as much iron in it as red meat does. And Every teenage girl should take a multivitamin with iron every day of her life from the time she gets her first period. That should just be standard. It gets them their vitamin D because they're really poor at getting in enough milk products. It gets them their iron, and it gets them in their folate because you want folic acid if there's any possibility that you could get pregnant to prevent neural tube defects. So every teenage girl, once they get their period, should just take a multivitamin every day, period. Narcolepsy, Dr. Kuhn talked about a little bit as well, and that has a very specific set of diagnostic criteria, and both restless leg syndrome and periodic leg movement disorder and narcolepsy have very specific treatments that can be used, very specific medicines that can be used to help people with them. Fibromyalgia is another diagnosis that has a lot of overlapping symptoms that might overlap with depression, it might overlap with thyroid disease, might also overlap with chronic fatigue. And the difference mostly being that kids with fibromyalgia and adults with fibromyalgia hurt. They aren't just tired, but they hurt. And they hurt in lots of places, and they hurt most all the time. So it's not just fatigue, it's fatigue and pain, and really sensitive pain beyond what you would normally experience, usually muscle pain. So that's a little bit of a difference as far as fibromyalgia goes. Going back to talking a little bit about chronic fatigue, one thing that is really good about that diagnosis is that in teenagers, chronic fatigue is something that they have a much better prognosis of recovering from than adults do. In adults, the percentage of people who recover from that and get back to normal function is probably 50% or so at best. In teenagers, it's more like 80%. So that's a really good thing about having that diagnosis and being a teenager. I think it's important to say that there are things that you can do to help promote sleep in children of all ages, including adolescents. One of the things that I think it's important to talk about, and I didn't put up here, is it's really important to try to establish that regular sleep time, that regular wake time, and to stick with it as much as you can. I know that there are sometimes when it's impossible for teenagers to stick with a regular schedule, but when they can, they should try to. Any time that you can get a teenager to not have any electronics in their room is a really good thing. My kids think I'm a Neanderthal because I don't let them have anything electronic in their room. They've got no computers, they've got no cell phones, they've got no TVs. If they want to watch TV, they have to be downstairs with us watching TV. That's okay because I want to know what they're watching anyway. And that way I can observe them. We keep the computer in the family room. They have to watch it. They have to do their stuff there so I can see what they're doing. And then when it's time to go to bed, it all goes off and they go up and go to bed. It's important also to make sure that their bed is for sleep and that that's all that they do in their bed. I think that that's a really important thing to sort of create that environment where your bed is a place where you sleep, and that's it. You don't do your homework on your bed. You don't have your friends over and have parties jumping on your bed. Your bedroom's a place for sleep, and that helps to kind of create that this is the place where you sleep environment. There are other things that can help you to sleep better, and some teenagers are really interested in learning other things to help them to sleep. So these are sort of alternative therapies to help you to kind of create that calmness that you need before you go to sleep at night. Things like, first of all, getting exercise, we know can sometimes improve sleep. There's not a lot of good data on it, but what we do know is that you shouldn't exercise late at night. All right, your exercise needs to be earlier in the daytime. If you exercise right before you go to sleep, it's not good. That's a stimulant for you, and you don't want to be stimulated right before you have to go to sleep. Yoga is something that actually there is some data on is helpful at going to sleep if you learn how to practice yoga. And the same holds true for meditation. I tried to find data on that old standby that everybody has heard about, the glass of warm milk. Couldn't find anything. So what I can say about it is it doesn't hurt anybody. I know that for sure. And maybe there are some people who swear by it. I couldn't find any information on it. And massage therapy sometimes is helpful too. Alternative medications are other things that you can find out there at the GNC or other other stores that have been touted as being helpful at getting you to go to sleep. I know that chamomile and lavender, there's some data on them being helpful at helping you to go to sleep, and that's really breathing in the vapors from chamomile, whether that's tea or just like a scented sachet, and lavender as well. And a lot of people see those things advertised for soaps for babies that have lavender in them, and you're supposed to use it in the bath at night, and it helps them to calm down and go to sleep. And there is some good data that those are calming things too. So having those around as sort of using oils and having that scent in the air is something that's helpful. Other things that can help you sleep, these you can get from some places, and people can order these things on the internet, so I know they do, are things like valerian and kava kava, and those are actually, they can be dangerous if you use them, if they're packaged in the wrong amount, and they're not something that's regulated by the FDA, so if you order those and you try those, you have no idea really how much you're getting. And in children, these things haven't been studied at all, so I usually tell patients, I want you to stay away from things that you can get that will help you sleep over the internet, because you never really know what you're getting for sure. You never know how much you're getting, and you don't know what this effect is going to be on you. So it's something that you should not experiment with, and they can do things like have significant side effects like problems with your liver, problems with amnesia, other big problems getting up in the morning as well. So I think that those are things that people should be warned to stay away from, and that's a little picture of lavender and chamomile. Other medical treatments for difficulty sleeping would include over-the-counter things, and these are things that people use all the time. I know that, and I usually ask people about it because a lot of my patients who have trouble getting to sleep have already tried some of them. The over-the-counter stuff, everyone knows Benadryl, which is diphenhydramine is the chemical name of it, and Benadryl is the thing that's in Tylenol PM and all those whatever PMs that you get that you can buy at the store. That's what's in them. It makes really, the data say that Benadryl causes sleepiness in about 10 to 20% of people. So if you take your Tylenol PM and it doesn't make you sleepy, that's no big surprise. There are a small percentage of people also who sort of get a paradoxical reaction from taking Benadryl, which is it makes them crazy. So you certainly don't want to try using Benadryl to sleep at night the night before you take your ACT test, because if you're one of those people and you find out that night, you're going to have a terrible day the next day. So that's, I think, important for people to know about. Melatonin is this hormone that your body makes on its own, and uses along with sort of sun and dark to regulate your own sleep. And some people, you can kind of accentuate that by giving them melatonin before it's time to go to bed. So you sort of create a false surge of melatonin that makes them sleepier. And this is something that has been proved to work to help for a while. It's not something that should be used every day, though. It's something that you might want to use when you're changing time zones, if you're changing your sleep hours for a limited period of time, but it's not something that's meant to be taken for a very long time. And the dosage that's required varies from person to person. I think it comes in the lowest dose at like 1 milligram all the way up to 10 milligrams. Melatonin actually is something that's been studied a lot more than other things in kids. Benadryl and melatonin have both been looked at in kids specifically, which is really nice because sometimes when we look at things that we give kids, we just have to extrapolate information from what we know from adults, which really isn't right, because kids are very different than adults in the way their body metabolism is. And these have been studied in kids. Melatonin, we know, has been studied well in kids with special needs, so and has some benefit in kids with special needs. Prescription medications that are sometimes used to help kids to sleep would include things like chloral hydrate. This is not something that I recommend using, and I don't give out to teenagers. Chloral hydrate is metabolized by your body basically to alcohol. So what happens is you basically just get drunk, and that makes you go to sleep, and that's not a good answer. It's something we use to sedate kids for procedures, but that's really its only place. And then other sedatives, things like Ativan and hypnotics like Ambien that you may have heard about on TV, those things will help you to go to sleep, but they're intended for temporary use because your body adjusts to them and accommodates to them, and their use wears off after a while. You have to increase doses to get the same effect, and they can be habit forming. And when you stop them suddenly, you can have significant rebound effects. So I think that those are things that really I don't prescribe for my patients, and I don't recommend people take unless they are very specific to a certain situation. Finally, the last thing that I wanted to talk about was something that I think is really important, and many communities are looking together at what things they can do to improve how their teenagers make it to school. What you notice in most of the school systems is that school starts at X time for the grade schoolers, goes a little bit earlier for the middle schoolers, and it goes even earlier for the high schoolers. That doesn't make any sense. Right when kids are sleeping later, getting up later, we move their school earlier. Right when their clocks are saying you need to stay up later, their internal clocks, we're making them get up earlier. And there are many communities that now have said, this is just not right. We need to fix this problem. We're going to make our high schools start later. And we're going to switch everything around so that the schools start later. And they have found, surprise, surprise, a lot of positive benefits of this. They have fewer kids falling asleep during early morning classes. They have fewer kids that aren't showing up on time. And they have even got data now that say that these teenagers are having fewer car accidents because they're not as sleep deprived. And that can happen from a change as little as some schools have changed their start times as little as 40 minutes. And seen effects like this. So I like to challenge people to go out and make a difference in your community, talk with people, and see what they think about these things. This is an important thing that we should be talking about. Why are we making our teenagers get up so early when their body clocks say that they're supposed to sleep later? And that's something that we could do as a community to potentially change life and make it better for our teenagers. So I think that's about the end of what I had to say. So I was just going to open it up and see if anybody had any questions. I wanted to ask any questions or talk about personal experiences that they might have had. Yeah.
Do you have to have a specific test to see if you're anemic, or can they just tell by any blood sample?
Okay. So the question is, what kind of test do you need to tell if you're anemic? And it's actually a blood test, and it's something called a blood count or a hemoglobin. Often, if I'm worried about anemia in someone, I not only check that hemoglobin, but I will also check their iron, because sometimes you have kids who aren't yet anemic who have very low iron, and that can be something that also can affect your level of energy and fatigue. So sometimes I'll do both of those in my teenagers who have fatigue to see how that fits into things. But basically it's something called a blood count that you do. And a lot of offices can do a quick blood test called a hemoglobin right in the office to check and make sure that you don't have low blood, and some people call anemia low blood. It's low red blood cells.
It also have affected if it could transfer down to either me or one of my 3 siblings. So.
That's a good question. So anemia can definitely be something that runs in families. There are certain types of anemias that can run in families, or also sometimes what runs in families from female to female is a propensity to have really heavy periods. And so a lot of times what you'll hear is, I never had anemia until I hit puberty, and then I got anemic, and I've been anemic ever since. And sometimes that can have to do with a bleeding problem that runs in the family as well, that some people need to be tested.
Thank you.
Yeah. Other questions?
I'm sorry, Dr. Kuhn,
Yeah.
you were talking about the delay in could you explain that just a little bit more? I'm sorry, you went just a little fast for me. What's the average delay, or how do I know what time to?
You oftentimes will see a 2-hour swing in preferred bedtimes, awake times from pre-puberty, okay, through adolescence. So by the time most teenagers are hitting their 17, 18, 19, it's very difficult for them, even if they shut the lights off and go to bed in a dark environment, it's very difficult for them to fall asleep before 11 o'clock. Now, there are obviously environmental, cultural, there are a lot of factors there. A recent study, they actually looked at, I'm trying to remember which country it was, but they actually looked at teenagers' sleep patterns both before and as they introduced electricity into their homes for the first time. And there's a huge swing, and it's immediate and very impactful. So we think that part of the biological factor that is accounting, and the research is going on right now with this, may be their sensitivity to light. And as we know, light is actually linked to melatonin, the timing of melatonin onset.
So darkened curtains?
Yeah, it's not just darkened curtains, okay? I mean, literally, we need to get the lights down at a decent time. But if you had to put your money into one kind of dose, it's really bright light exposure upon awakening or in the early morning, okay? It is your best. It's 4 times more powerful than a melatonin pill, okay? That is your best bet. And it's easy to get some times of the year, but as we go into other times of the year, especially here in Nebraska, that's pretty tough to get in the morning. Okay, and that's why sometimes we'll put these teenagers on bright light or lamp therapy in the morning.
Next question is, can you alter this cycle on them?
Absolutely.
Okay.
And that's basically, if you've got a teenager with delayed sleep phase syndrome, and that's the majority of the kids that come into my practice, at least the teenagers anyway. Number one, you can either try to change society and the environmental demands by altering school start times, reducing, I've got 3 daughters at home, shall I say primping time in the morning to let them sleep a little bit longer. Girls do get less sleep than boys, believe it or not. So you can either alter society and the environmental demands, or send them to college early and just have them take a noon class for the first period. Everything's fine, but otherwise you're trying to alter their sleep physiology, and that is you're either trying to move them earlier. Change their physiology so that they actually are sleepy earlier in the evening and more alert and ready to wake up early in the morning. Okay. Not to throw you too much into a funk here, but sometimes we actually do the opposite. We'll actually take them around the clock in the other direction. It's tough to get a kid who's used to and whose body's accustomed to falling asleep at 1 in the morning or 2 in the morning to move them backwards, okay, to 12, 11, 10. So oftentimes we'll actually have them stay up. We'll put them on a 27-hour day. So instead of them moving their bedtime from 2 a.m. to 1, we'll move their bedtime from 2 a.m. to 5 a.m. to 8 a.m., etc. And I've actually charted this out and worked it out where oftentimes we can accomplish that within about a week and they only miss 1 afternoon of school. So it's one thing, though, to get physiology, to get the circadian rhythm shifted, okay, and back in line with societal demands. It's another thing to keep it there. And again, melatonin can be helpful, bright light therapy can be helpful, but oftentimes you've got to attend to those factors that produce the phase delay in the first place. And oftentimes that's late night electronics, lights, electricity, habits, caffeine use, etc., all the things that kind of produce that. I've seen a number of kids who have delayed sleep phase syndrome who have good reason to miss their first couple classes of school. Okay, so you've got to rule out school refusal, school avoidance, social things. So sometimes it's very functional for some people. So a number of factors there, but basically it's a 2-step process, and that is shift their circadian rhythm to get it in line, and then you got to tackle the tough task of keeping them there once you've got them there. Good question.
And one of the other things I wanted to add was, I didn't mention this in the talk too, but Dr. Kuhn mentioned caffeine, and we should be having teenagers turn off their caffeine after lunch if you really want to help them to go to sleep, and that can be a really hard thing to do. A lot of them have caffeine all day long and into the nighttime. I tell people by 2 in the afternoon you should be turning your caffeine off too.
Your problem, and you were saying fluids. I'm having a bigger problem with my son as you go to clean his room each day and there's 10 water bottles in there because he's getting enough fluid. So I don't think that's our issue. I think it's just the old parenting habit of, okay, go to your room by 9 or 9:30. I don't care if you don't go to bed till 10 or 10:30, but I want you calming down and quieting down. Well, yeah, that's just turning the sound lower on the TV. The TV's still in there though, so I think that's...
Yeah, and that's a tough battle, and it's a really hard battle for people to fight. Once the TV is in the room, getting it out is really hard. I try to counsel parents when their kids are little, don't put anything in the room because it's hard to get it out. Is it? Okay.
That's always been one of
All right.
TV unplugs pretty easy, so.
There's now 7 studies suggesting that children and adolescents with televisions in their bedroom get substantially less sleep. Just that factor alone.
Yeah, and anymore too, that's true of the cell phones especially, because they can flip that on and talk with their friends anytime. They can text, stay up late at night texting. I have a friend who has his kids pass him their phones before they go to sleep, go up to their rooms at night, because that way he knows that they're not texting.
Yeah, I'm kind of on the same page with my kids as you are, and with yours, they don't have cell phones yet, so they think that's a crime.
They do, but you know what? There are much worser crimes, so that's okay.
He does have a TV, so I'm guessing that's where our issue is.
I'll tell you, as a dad of 2 teenage daughters, the one thing I'm going to invent and become rich doing it is a remote control that shuts off the power. I'm going to be able to, from my bedroom, shut off the circuit breaker down that hall and take care. We're going to make it night automatically. Wow. So it's tough. It's not easy.
And I think that we need to formally kind of close for the webinar and just say that we're done there. And thanks to anybody who's out in computer land for tuning in to the webinar here. And we'll still stay open here for anybody in the audience who has other questions. So.